Hi, I'm Dr. Buonassisi. I'm a facial plastic surgeon, and I'm the medical director of 8 West Cosmetic Surgery and Medical Aesthetics Clinic. Welcome to our newest video series where we explore surgical and non-surgical options for rejuvenating the periorbital or the area around the eyes. I'm a board-certified facial plastic surgeon, and my practice is here in Vancouver, British Columbia. I'm also surrounded by a large team of nurses, medical estheticians, and a whole team of patient care providers that help me run my practice smoothly and give a great experience for our clients. Our unique approach is that we offer both non-surgical and surgical treatments for facial rejuvenation and medical aesthetics. This allows us to offer a comprehensive treatment plan that can combine therapies, not just surgical and not just non-surgical treatments, but we often work together as a team to give the best possible options for each of our clients. Our treatment plans are very customized to the needs of each of our patients. And because we're a surgical practice, we're able to give a 4D assessment of the face where we treat not only bone, muscle, fat, but also skin. Our team of experts includes surgeons, registered nurses, and medical estheticians. We offer a comprehensive list of surgical procedures that help to either rejuvenate or reshape the eyes, the face, neck, nose, and ears. We offer device-based skin treatments. These are lasers or energy-based devices that are used to rejuvenate, tighten, and brighten the skin. We offer injectables, which come in the form of neuromodulators for relaxing muscles or repositioning structures of the face, along with fillers, which can be used to augment and reshape the face, partly for rejuvenation, but partly as a way of improving the attractiveness of certain features. And finally, we offer medical-grade skincare products, which when used in conjunction with other treatments can highly benefit the skin. So let's dive into our topic on rejuvenating the brows and periorbital areas. When it comes to the upper eyelids, we want to have the skin reasonably tight, and I think most importantly, it's ideal if we can see what we call the tarsal platform. And this is the area of skin that sits just above the eyelashes that essentially frames the eye. That tarsal platform varies in height from person to person, but uniformly, if we can see the entire tarsal platform, it often frames the eye and makes the eyes look bigger. Ideally for the brow, they should be high enough that they allow a reasonable space for the upper eyelid to be seen. In addition to that, the peak of the eyebrow typically should be more lateral along the eyebrow. Now you could theoretically line that up with the edge of the limbus or the edge of the iris, although it seems in recent years the trend is to have the eyebrow elevated more laterally. So rather than a peak perhaps at the junction of the lateral thirds, to have the peak actually the entire tail of the brow. And that varies from person to person. The other ideal really with the brow is we want to get the brow pad, which is a sort of a puffy soft tissue structure. We want to get that at or just above the brow bone in women. The ideal for the lower lids is that they be as smooth and shadowless as is possible, and that the cheeks support the lower lids and provide a pedestal for them. The ideal shape of the brow really varies from person to person, but the modern thought is that the peak of the eyebrow laterally should be either lined up with the edge of the iris, which is the colored part of the eye, or be lined up with the lateral canthus, which is the very corner of the eye. So we're tending to have the peak of the brow a little further out these days than what was thought to be attractive previously. And that varies. I think in the future, those things will change as well. I think the other thing to consider with the brow is it's not just the hairs of the brow that we're looking at. It's also the fat pad and the soft tissue underneath the brow that can sometimes sag and almost feel like it's hanging on the lower lid. And so we want to reposition that and have that at or just above the orbital rim, which is the bony outline of the eye. The non-surgical treatments for rejuvenating the brow include things like microblading or tattooing of the brows to change their position or shape. The brows can also be slightly elevated by using neuromodulators, and those neuromodulators essentially relax the muscles that are pulling the brow down and allow it to sit in a slightly higher position. And I think for subtle changes and for people who are quite young, that's a great treatment for that. The last is to use fillers to augment the temporal area, and that can often give a little bit of a boost to the lateral brow as well. The surgical options include the traditional coronal brow lifts, where incisions are placed across the brow, endoscopic brow lifts, which are done again from within the hairline, and then more direct and probably more minimally invasive procedures where the incisions are placed closer to the brow. So we've just covered the brows. Let's move on to the upper eyelids. Touching briefly on non-surgical options for the upper eyelids. In most cases, if there's a little bit of wrinkling of the skin, then I think laser resurfacing can be helpful for that. But in general, the main reason patients come to see us about their upper eyelids is that they have extra skin that's hanging down further than they like. And there is not a non-surgical way of removing skin. So, I think there's limited benefit to the non-surgical treatments of the actual upper eyelid skin. Although the areas around the eye, of course, there's lots of various options that people seem to really appreciate. Keep in mind that at this time, there really isn't a technology that allows us to remove skin. It's possible to smooth skin with lasers, and it's possible to get some degree of tightening of skin. But if there's skin that is loose or hanging, there's just no way of removing that without doing that surgically. Maybe someday that there will be a technology that allows us to do that, but currently we need to remove it. And it's important not to confuse removing skin with a laser, where we actually use the laser to cut the skin, versus just applying a laser and miraculously that skin disappears. There just isn't that type of technology available. So the main options surgically to rejuvenate the upper eyelids is, well, there's really a couple of ways of doing this. One is to elevate the brow, if that's the contributing factor. So in some cases, the brow sits so low that the skin is being pushed down onto the lid. And in those cases, lifting the brow up is really all that's needed. In the majority of cases though, there's extra skin that accumulates in the upper eyelid, and it starts to hang down almost onto the lashes. So there's really two main treatments that we offer for this. And one is called a traditional blepharoplasty, where skin, possibly a little bit of muscle, and also some of the orbital fat is removed. And those are situations where there's puffiness in the upper lid because of fat that is bulging forward, in addition to having excess skin. Generally, that's in our older patient population. The third treatment that we offer is called a sliver blepharoplasty, and this is by far the most popular. What it does is it allows us to remove the excess skin, but doesn't remove the underlying muscle and doesn't remove underlying fat. And that maintains a very full and youthful looking eyelid, but removes what generally bothers people, and that is that extra skin that's hanging down, and it's making their tarsal platform, or the frame of the eye, look thinner than they like. And of course, in some cases, a combination approach is ideal. So in a case where the brow sits quite low, but also there's lots of extra upper eyelid skin, then a combination of a brow lift and an upper blepharoplasty is really a great choice. And I think in a lot of cases, that can be very helpful. And we often combine blepharoplasty with non-surgical treatments as well. And a great combination is removal of the skin surgically, but then a gentle elevation of the brow and smoothing of the periorbital wrinkles with Botox. So there's a combination there where you can improve not only the brow position, but the excess skin all together. So we've covered the brows and the upper eyelids. Let's talk about the lower eyelids. Shadows and grooves are caused by either an excess of tissue, so a bulging of orbital fat, which then creates a shadow, or a loss of tissue, which is often a result of the lower lid starting to descend. So those can be addressed in two different ways, but there's actually an interesting and unique way of treating both at the same time, and that's called an orbital fat transfer. So the main reason we do surgery for the lower lids is for the bulging. And if there's a bulge of fat in the lower lids, then that fat can be removed. If there's a groove underneath, then that groove can be filled, either with the fat that we use or that we remove at the time of surgery, or it can be filled with a filler like hyaluronic acid. So the non-surgical treatments for the lower lid are mainly related to trying to camouflage or fill the depressions. So sometimes a bulge of fat will cause a little bit of a depression to appear underneath, and that depression can be filled, and that will camouflage the fat bulge. And I think in situations where those features are subtle, I think the injectable treatments work extremely well for that. That can be combined with a small amount of Botox for the periorbital wrinkles, and I think often people get a great result from that. Other treatment options include microneedling or PRP injections, and probably the gold standard for making the skin itself smoother to get rid of wrinkles is full field laser resurfacing. Now keep in mind, these are treatments that are aimed at making the skin texture look good, but they're not going to improve the bulges or the shadowing. So I think a combination of treating the surface skin with either laser or non-surgical skin treatments, in combination with filling the grooves or taking away some of the fat, can give a very nice result to all of the layers of the lower lid. So the surgical options vary, and it really depends on a patient's age, the tone or the firmness of their lower eyelid structures, and also what is the problem that they're coming to see us about. So for example, in many cases, particularly in our younger patients, the main issue is that they've got fat that is bulging forward and it makes them look tired or it makes them look like they've got allergies. In situations like that where the skin is otherwise tight and youthful, taking the fat out with a small surgical procedure really works great. Now, as people get a little older, or if they start to get extra skin, we start to need to think about sometimes tightening the lower lid. And so that often requires an incision just at the border of the lower lid and lashes, and that's called a subciliary incision. Typically in our practice, we do a minimally invasive type of procedure like that where we keep the underlying muscle intact, but we suspend the muscle to pull on the lower lid skin and also elevate the cheek a little bit. We call that an orbicular stitch. Finally, a fairly extensive reconstruction of the lower lid would involve lifting the skin up, but also going through the muscle and transposing the fat into the cheek. So this is a case where the fat that is sitting underneath the eyelid is used to actually bulk up or to support the tear trough, which is the hollow underneath. And that's called a fat transfer. That can be done either from inside the eyelid or behind, or it can be done externally through a small incision. There are many ways to treat the lower lid, both surgically and non-surgically, and it's actually a very complicated topic. I find it very interesting, but I think counseling patients and providing them with the various options is extremely important, because I don't think there's actually one procedure that is ideal for the lower lids. I think it really depends on the person's age, what their goals are, and their tolerance for surgery. So stay tuned, because further along in our video series, we're going to show you a documentary where we've done a brow lift and upper blepharoplasty for a patient, and we'll allow you to sort of see how things progress from start to finish.